I'm gonna go in the hallway. Make a little intro. Hey everyone. So we are now live. And today, since it was such a hit last time, we are going to be doing another live demo. I'm just gonna start waving to everyone. So it will be another filler demo. We'll do facial and lips, and then yours truly is also getting her lips done as well. I am so excited. So let's go in and see what Dr. Sarah is getting into.
You're not supposed to unless you order products.
Okay, so we are demoing a new filler, even though I plastered the photos all over everything already. We're demoing a new product that I'm not supposed to talk about, but if you look in my Instagram post, you'll see the name of it. I'm going to be injecting in a few different places, but for this demo, I'm going to be injecting in her temples. You can see how they're sunken in compared to the rest of the contour of her face, right in this area. I marked it out with the white thing. So this is just a little surgical scrub to make sure sterility is a must. This is the other Dr. Yovino right there. So here we are. So we're gonna what? It's gonna hurt a little bit. I'm gonna shake.
Justin killed me.
Hey.
Oh, I take it back. Oh my God. I was really joking.
It's a sensitive zone.
Oh my God. No.
You can see it filling up right there.
Oh yeah, it looks nice.
And here.
Love that.
Let's make a nice stick.
Mm-hmm.
Here.
Yeah, that's gonna look good.
Mm-hmm.
She says you hate this, Ariana.
Kill, hate.
I'm out.
This area does
painful.
go
Oh, that looks, wow.
so nice already.
Mm-hmm.
Just need a little bit lower right here. So I'm gonna just aspirate to make sure there's no blood. I'm gonna do a slow injection. Already looking great.
Yeah, that looks beautiful.
So I have a little bit. I have I see 0.1 and then the last hashtag. So you're saying people think this is the 0.1 up here?
Yes. The
Okay. But
last.
the last one's the out.
Yep.
Yeah. I'm gonna do a little bit right here because it looks like it.
So, Dr. Sarah, who's a
Yes.
good candidate for temple filler?
Anybody that has wasting of their temples. Yeah, oh, I see that. It is kind of right at 0.1. So, thank
Another?
you. I think it's a good
Wow.
start right there. Just getting a little swollen. I'm just gonna smooth it on out. How was that? Not too bad?
No, not too bad at all. Better than me.
Yeah.
Dr. Justin's in the house.
Hey.
Yeah, it's almost like, I don't know if someone in here needs a little bit of a smoother product, or this is not the smoothest. This is the medium smooth.
Yep.
Let's see how that side of settles down, because it's a little bit here. What's up, Reed?
No,
Are you gonna do the other side? Okay, yeah. Great.
I know what you want.
Okay, so that was a little bit of temple, so we'll do the other side so she's nice and even. Let me just kind of clean this up.
Sorry about the comment. It's okay.
I didn't mean
And you said that it's already a hydrated product, so it does not swell much more than.
Going for the other side.
So the good thing about this filler is that it's already kind of hydrated, and so it's not going to cause much swelling beyond. It's not going to cause much swelling beyond what we see today.
Yeah.
Yeah. Okay, so clean in the area. Okay. Nothing. Okay, here we go. Right here. Like that.
Wow, 2 top docs. How lucky are you, Deb?
I'm a lucky girl.
Nice. Okay, now one more. Any comments, Justin? I feel like you're about to say something.
Oh no, I'm
Okay.
just watching the mask. Just thinking about my mommy.
Yeah, for everyone who doesn't know, this is Dr. Justin Jovino's mother that I'm working on right now. No one to mess around. Okay.
So for those just joining, we're doing a live filler demo today. We got the squad all here, both Dr. Jovinos, and a very special patient, Deb, Dr. Justin's mom,
Smells a little bit inside.
president of our fan club.
Yeah.
President.
President of the fan club?
Yep.
That's true. Yeah, thanks.
So here's a great question. Is Radiesse best for under eye cheek? I want to create a harder angle.
Under eye cheek.
You mean like right here?
You're talking about there, yeah.
Are you talking about like the malar
It
area?
must be, because they're a harder angle, so it's probably referring to this area. I guess it's fine. I mean, it works. It's
They're all great. But Radiesse is not reversible, so just be careful.
so yeah, we tend not to use it. You know,
I did hyperdilute.
yeah,
I like
we
that.
use it sometimes. It's not
We're not talking
a
about Radiesse, we're talking.
Radiesse is not
Yeah, I used to work
our
for
go-to because just you
Right.
can't reverse it, and not that we do a lot of reversal. But if you want a little tweak and you want a little gone, you don't have that option with.
So in this, you said that I could stick very superficially in this area, right around the mouth.
Yeah.
Can we try one, and we'll try to sprinkle it all over? This would be number 2, huh?
That'd be two, yes.
No.
I don't know if you do.
I'm not doing her lips.
Oh,
I'm doing right here.
Is there a hollowness triangle on the face? She said for the hollowness triangle. I want to create a harder angle.
you must be talking about the submalar area. You're probably talking about this zone.
Mm-hmm.
So yeah, I mean, putting volume across the cheekbones helps accentuate
This one
this
was
kind of hollowness.
This
here.
was 3.
Mm-hmm.
So it's all volume
This is two.
up high up on the
But I
cheekbones
thought
here.
3 was the
No
one for
volume
here,
into
no?
this area.
Three
Okay.
is for like
Under
medium,
eye, yeah.
Yeah, I mean, you
wrinkles
know,
and
when
folds.
people say under
A
eye,
little more for volume versus 3, and that's more of like air pressure.
That feels good.
when we refer to under eye, we're referring to this junction between the lower lid and the cheek,
Mhm.
all along this area here. But you know, any place can be under the eye, right? So if someone could be referring to this area as under the eye or this area, but you know, when we say like putting it into the tear trough
I
area,
want you to
Mm-hmm.
kind of ice this area.
It's,
if you can hold it.
Me?
just
Yeah.
right on the lower eyelid.
Mm-hmm. So what are we doing now, Dr. Sarah?
So now I am preparing a syringe to do her smile lines.
Okay.
We're gonna do her smile lines right now.
Move it. Just move around. You can just
You can go so superficial that you can just bury the bevel of the wheel and start injecting if that's what you want to do.
Okay.
Yeah.
And this one probably comes out quickly.
It's a 30-gauge needle, so it's actually going to be a little more of
you
an
could
extrusion
control them
force
up
than the
in
last
this
one.
area too, but just especially just this junction.
Uh-huh.
It looks nicer.
Wow.
So you probably actually use a little bit more in here, but that's good to start.
Yeah, that's good, especially that edge, which is
Mhm.
what sticks out the most.
So I'm gonna just bring your head down a little bit. Okay. And so, see how she's losing support like this?
Yep.
And even down here. So I'm going to build that by going across that to support that fold. By just injecting very, very tiny amounts of filler. So let's try this. Like that. You want to ice the other side? You can go ahead and do that.
Let me see your ice cream.
So you're talking even more superficial than that, right?
You can go superficial as you like.
Let's try that.
You will not see a tingle with that product.
Wow.
So that's very superficial, you can see.
Mm-hmm.
Yeah, I don't want to go that superficial. Very good.
You okay?
Mm-hmm.
I know this can be a little pinchy in the.
I know that
superficial
shaking is
plane.
probably bothering you.
Yeah.
Just kidding.
Not really.
Deb, your skin looks beautiful.
Thank you.
Must be all that YovinoMD you're using.
Mm-hmm. Twice a day.
Love it.
And she just started the growth factor too.
Oh, awesome.
That looked just barely any 0.2. You can see how it's just opened her up a little bit. Let's try the corner of your mouth.
So who's a good candidate for filler in this area, Dr. Sarah?
Really, anybody that sees volume loss in here. What's up?
Too cold over here?
Mm-hmm.
No, it is me.
Got a frostbite over here.
Right.
Yeah. Look at this little line right here. So we're just injecting some of these superficial lines.
And do a little Botox on her too down there today.
Okay, great.
So for those of
So yeah, this is nice because it just kind of really, it does kind of give us a little bust. What's up? So that kind of disappeared. That's nice. And then this side doesn't have
ooh,
too
that
much
looks
in there.
nice.
It's nice.
It's nice.
It's nice.
Very nice.
Yeah, here, this side too. You want to go on that side and
Oh wow. Look at that.
she doesn't even have that. You're like nice and
Is that normal that people's sides of the face are different?
yes. Usually the left side due to sun exposure, driving, sleeping on that side. Usually there's more damage on that side of the face, but everyone is different. Everyone's different. On Deb's, it's definitely more on the left. I probably don't need quite as much in this area on her. I'm just going to give her a little support as we go down.
Everyone's saying you look great, Deb.
Justin's mommy.
President of the fan club.
That's right.
You know, the last time Dr. Sarah did my filler, she also did my nasolabial folds, this area on my face. I had never had it done before, and it really, I feel like...
The needle gets a little dull too.
Yeah, it does. You got that feedback.
And yours seems to get double flicker, but it's the same as the other ones, right?
Yeah.
Known for his bedside manner.
We were told it's the same as Gilbert and Rose, but I don't know.
Yeah, they are. Yeah.
So how long does this filler last?
It lasts up to 15 months.
15 months, that's a nasolabial fold study, so you can expect
Wow.
some variations in different areas of the face.
It's always exciting when there's a new product on the market to kind of disrupt.
Right, so 15 months this filler is supposed to last, which is great. It's longer lasting than the other fillers. Some of the other ones are 6 to 9 months or something like that, you know. Some are 18 months depending which company you go with.
And doesn't some of it depend on like the person?
Yeah, some people's metabolism, I should have hit that with the IPL today too. Some people's metabolism chews through filler a little bit quicker if they're somebody who works out constantly and every single day, then it may not last as long in them as it would in somebody else. So yeah, you can see that. And it feels like stiffer, it even feels stiffer within it. But you said it incorporates in the tissue nicely.
Yes. It's their selling point.
What'd you say?
So that's one of their selling points.
Okay.
So for everyone just joining us, wow, everyone apparently
What?
had the alarm set for 5 p.m. So for those just joining us, we are doing a live filler demo today. This is Dr. Justin's mom here. We got the whole squad up in here.
So we're just filling her smile lines. Deborah is, can you tell me your age?
Mm-hmm.
how old is this?
66.
Wow, your skin is amazing.
Justin's mama's 66 years old, and we're just smoothing out her smile lines and making them look very natural. This is a great brand new filler on the market, and we are testing it out today, and I think she looks really good and natural. You wouldn't look at her and think she has filler. And I've only used one syringe for this entire part of her face.
Wow.
So, and I'm just smoothing out very superficial areas that she just needs a teeny tiny bit of filler in. You have like a little. What do you think?
I'm just looking at
Sagging.
No. Maybe they'll be able to watch your facelift live too. She's like, I'm not. That's the next time you come visit.
I think it's the Lipo 360 that's next for her.
Wow. Deb, they're saying you look incredible.
You do. Okay, so we're almost done here. So
We did temples.
we did her temples because they were very sunken in. You can see them here. And then we smoothed out her smile lines and a little bit of the lines around her face. And she does not look bulky at all. And she won't swell much more than this, which is great.
Mm-hmm.
You know?
Beautiful.
Yay!
Yay! Lucky me.
I think that's good. I think you're good. I wouldn't really inject you anymore. I think you're good. Oh, you said the eyes, but I feel like you're already. I think it's the more dark circles under the eyes, but you don't really need a filler there.
Yeah, the Vivo on her up there.
Yeah.
Some skin.
You know?
Yeah, her cheeks kind of.
Yeah. I don't think you're an eye candidate. So we're just gonna. So we're all done. We injected her temples. So she was really sunken in this area, and I did a series of injections on both sides to make it a little bit smoother. And then we injected the product here in her nasolabial folds and a little bit down here to smooth out some of the lines that were forming in her lower face.
Beautiful.
At 66, I think she looks amazing.
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 Gorgeous.
Yeah. Gorgeous. Now the next person that's up is Ashley.
Me.
We're just gonna
A little switcherooski. Sorry.
switcheroo.
Here, if you want to come on over here.
Come with you. Justin, do you want to hold the camera for?
Yeah, I will. I'm gonna grab the glasses. You wanna hang out here while she does it, or do you wanna go sit in room one? It's up to you.
So we're getting all settled. Just give us 1 second to just turn the room over. And then we'll have Ashley get started. We're going to do Ashley's lips.
Yeah.
And
Temples?
Yeah.
you want that? Or right here?
Yeah. I'm down for that.
So we're going to do Ashley's cheekbones, malar region, and then we're going to do her lips. So stay tuned. I'll change my gloves.
Subtle lip or bigger lip?
She likes juicy.
Juicy?
She likes big and juicy, this
Yeah.
one.
That's important.
Okay, you want to grab that?
What are we talking about?
So you need
Let's
the
spin it around. What?
I mean, I think that's what I want. I mean, because I feel like
You
they
think
just-
what are you talking about? I think that's what I want.
Yeah.
I think you do.
Yeah,
You
I
do.
do. You do. I do. I got a birthday
Yeah.
coming up.
2 is really natural and nice, and
Okay.
3 is going to be juicy.
Okay. Let's go to
Make it a 4.
We'll do 3. We'll do 3. I've been bugging this
What are we
one
starting?
for
We started-
months.
Every patient who gets her lips
What's that?
done, she's like, oh.
What are we starting with? Are we starting mid-face? Or are we starting lips?
Yeah. What was I have enough photos of you. I don't remember photos. Let's do. You want to do? Let's do mid face.
Start up top.
Okay.
You like a
Start from the
podcast
top.
host in a previous life or what?
Was I?
Yeah.
I actually used to be a sports reporter.
Oh, really?
Yeah.
Cool.
So that's
Show off.
That's an Emmy award-winning sports reporter.
All right, I'll give you the mic.
Yeah,
Oh, awesome.
yeah.
Two. Who's it? Yeah, two. So
I encourage you to stay superficial. You know people like to go down to the bone. If you're comfortable.
so cannula would be better if I'm gonna stick
People
superficially.
like cannulas, yeah.
Okay.
Off label, I have to say that, especially since you're recording.
No one's watching. Okay. So we're gonna get started. We're gonna build up our cheekbones a little bit. So the first thing I like to do is draw. Where's my pencil? I do this on dark, so let me get my sharpener.
If you just prefer to go to bone, do it. But the feedback we're getting is that that's what makes this product so nice, is the ability to stay superficial with it.
Okay. I'll try that then. So,
In your face.
I'm gonna look at this side. That's about right there.
So what you doing here?
I'm just getting her landmarks just to kind of see where I'm at and see if my eye, like she should be the biggest of her cheeks should be right in here. And this one's a little higher. So just kind of
Right. So I find, when I draw like you're working on it, you map out some general landmarks, and it really helps you see some asymmetries, and you see where you need.
Yeah, her
to
face
fill.
is like this.
But it brings out the different quadrants and allows you to kind of look at it in I don't know, a more analytical.
Yes, it's very
format.
scientific. Dr. Justin. So I'm going to get a little bit of numbing, actually a lot of numbing, because we're going to be doing her lips and we're going to be doing her cheek area.
And so now the filler has numbing mixed with it, right? Yeah.
Sure does.
So, but you're doing some additional numbing specifically for what? For the lips area?
So in the lips, I'm going to do a dental block so she doesn't feel her lips at all. And then in the cheek, I'm going to be doing skin entry sites. I'm going to just numb the skin for where the cannula is going to go in.
Okay.
So
Been waiting for this. Literally
Comfort care.
Months of asking.
yeah, jeez. I don't know if that's what I want. Like, right here. Yeah.
Just took a really generous rep to come your way.
Right?
Well, the thing is, we did her lips and they look really, really good. And then it just seemed like she chewed, because she's working out all the time, chewed through the filler quickly or
My
something.
body does.
Yeah. Typical.
Yeah, we did my.
You gym rats.
We did my. What's that?
Said you gym rats.
I know, right?
Go through it.
At-home gym rats.
So I'm just going to do a little teeny bit of numbing right here. Okay.
Stoic.
Right? It's not my first rodeo.
Shut
Down like an alligator underwater.
Definitely not.
Have you been injected before?
Yes.
Yes. Yeah, it's a nice hookup you have there.
Yeah, now it's.
You want to hear me, Sarah?
Oh no.
Yeah, if you want, you can scoot back in the door. All right. I'll give you.
I'm
You want
way
to worry
all
about it?
backwards,
Yeah.
but.
Yeah.
I'm joking over here. You couldn't see it. Joking.
Do you want to little vibrating thing?
What are you looking at now?
It's out of your mouth.
Are they?
Yeah.
Wow.
Either way. Now
So-
she's got very white teeth for those of you who can't see.
Oh, we can see. So she's injecting right now. She's doing some dental blocks. Access from inside.
So nice.
Yeah, and access inside the mouth is it can be a little more comfortable, placement, and a little more direct shot. Did you want to say?
Already kicked in.
Did you want to say something? I feel like you're ready to say something.
So it's 2 injections up here and then 2 injections down here, and if they need more, we go a little bit more superficial. Or I could just do more superficial injections, but either way. It just makes for a much more comfortable procedure.
That's great.
And so here we go. I like to do one here and then one for the corner of the mouth because that usually never gets any numbing. One here, the one in the corner. Okay. That's it.
That shaky move is key. All right,
It kicks in so quickly too.
Yeah, see, you can't even, she's not moving that side.
Yeah.
So that's probably numb.
Not yet.
How about this?
But yeah, I already feel it. It's super sweet.
Okay, so now I'm going to get the cannula ready. The cannula is a non-cutting needle. This is for the entry site, and this is the cannula, and then this is my product. Shh, don't tell anybody what I'm using. Okay.
Secret sauce.
The secret's on us. Okay, so here's the can. You see the tip of it is, I don't know if you can see that, but it's smooth with a hole on one side.
Hard to see. Yeah, maybe if you held it up against. Okay, I love that. So it's kind of hard to see.
I might want to do, let me just see how good this is.
So my lips feel really weird now.
You should sing Cher then, right?
She is my Halloween costume almost every single year.
And Nico's.
Yeah. So if you guys get your lips done with Dr. Sarah, it's called the Painless Lip Hog, but you just look really funky because why does it do that? Why does a dental block do that?
Well, you can't. I think one aspect is you can't feel anything, right? Because they don't look silly. Everything's moving.
Oh, really?
Yeah.
Oh, wow.
The numbness, I think, just changes the way you kind of want to move your lips around because they can't feel them, right?
Right.
And so it makes you feel like they're huge, but they're not.
Yeah.
And you just can't feel. It's like a numb part, right? That moves around, so you can't feel like
so
you control it because you don't know exactly where it is.
So weird.
You shouldn't feel this at all.
I feel a little.
You did?
Yeah.
Sure?
Yeah.
Alright. Turn you side. So we're going right here. He told me to stick superficially. You're going to feel a little tug.
Okay.
So we're going in right here with this cannula. She's not really feeling anything. You can see that where the tip of it is over here. And I'm just going to lay down a little bit of product. You can kind of see her cheek form. Do you see it? It's kind of forming there. So nice.
And she'll get more numb as she goes along
Because it contains, it contains 99%. I'm just going to, you know what? I think I'm going to use a bigger cannula.
Enhance these cheeks. Dr. Wilson, enhance these cheeks.
I'm going to use one that's slightly longer.
Okay.
Push some product. Let's see. Let's see. There we go. So you can go, turn. We'll go to about there on our cheek. There we go, right to where I want to go, the sweet spot. Where am I at? Okay, I'm going to keep going. You okay?
Yeah.
I like the markings. It really helps guide.
And then that's it. It's half the syringe.
Wow.
Yeah, you can see her cheekbone, how nice and beautiful that is. Let me get shing.
Like a Nike swoosh.
So did you feel that? What did you experience there?
I didn't really feel it. You feel like the entry, but that's about it.
Did you see how her cheekbone is nice and sculpted now?
Mm-hmm. Nice.
I can't wait
Definitely,
to see.
yeah, I can see it.
Wow. 36 going on 26.
I'm gonna turn you this way. It definitely bulked up, and it wasn't too. Oops. There we go. You can see it right here. I can feel the tip of the cannula right there too. Kind of laying down the product where her cheekbone would be, or should be, her nice arch. And that's it.
That was easy.
Yeah, it goes in nicely.
Look at the beauty.
Okay.
Yay. I've never had this area injected before.
No? No? That's good.
So this area is so numb.
Yeah.
Feels kind of cool.
Here, let's get you.
Cheers. Cheers.
Okay, let me test you.
Yeah. I feel like, yeah, sorry, Doctor.
Yeah.
All right, no, that's fine.
Sure.
Can you do the top load again?
So she's testing for her numbness, making sure that she's numb before she starts injecting. So
I feel that a little bit.
Here?
she's
I
just
don't
checking
feel
for numbness, and so
I don't feel that.
she needs to
don't
give a
feel
little
that.
bit more. She'll determine that.
Just a teeny tiny bit more on the one side.
Yeah. Because angles, Doctor.
No.
So she doesn't have any sensation of all that lower lip or this part, but she does a little bit here. So I'm just gonna give her a teeny tiny squirt. You probably don't feel this.
Nope. Nope.
Okay.
Look at that. Oh, fresh faced over there. Huh?
Who's that young lady over there?
Yeah, right.
Yeah.
No bruising, no swelling. That looks good. Yeah. Party time.
Party time.
Okay, so we're gonna do lips.
Me and Deb are gonna hit the town. Yep.
Did you want me to actually, stick to the same sort of technique as?
Yes. You know I love that border.
Well, yeah. Okay. Just I like to kind of keep everything
I
clean.
love
as
that
I-
one. Oh, it switched.
That was a good one.
Yeah.
Okay, so you said there's one. Okay, so this is number 2, no 3,
Yes.
because she wants juicy.
She wants juice.
I just did 4 in here.
Yep.
So for not syringes, but that's the number.
Number.
The syringes are numbered. Just the number 1, the number 2.
RHA 2, 3, and 4 is what we have currently. We'll have more coming soon.
Okay,
RHA 4 is our most robust.
got it.
So it starts at 2 is our thinnest, and it goes up from there.
Okay.
How is that right upper lip feeling?
Numb.
Okay. So Ashley already has a decent border, so I'm gonna really try to fill her pink to round her out more. So hopefully she didn't have any alcohol yesterday.
No.
Oh,
I don't think so.
Can't remember.
So here we go. Tell me if you feel anything.
Nope.
Okay, here we go. See where I'm at. And same thing with this product. I can stay as superficial as I want. Or this one's a little bit deeper.
A little deeper than the 2, but you can stay more superficial than you're used to.
Okay. Hold on, we gotta dry gauze. Sorry, Ashley, you're gonna be.
I'm not there to hand you your gauze.
No,
Actually, I can if you want me to.
that's good.
We usually say mid-dermis with this one, and then RHA 4 like mid to deep.
Looking good, girl.
Yay. If I'm drooling, I'm sorry. Just kidding.
So you can already see how much fuller this side is compared to this side that I didn't inject.
Oh, yeah.
Can you see that?
Absolutely.
So, can you bring her head down a little bit for me? Justin?
Yes, I'm
Yeah.
coming.
Okay. Good. That's
Good?
Yeah. So we're going to do this side now. Do you feel anything, Ashley?
Mm-mm.
So we're just injecting. This is a new product. So just going to mash it around a little bit. Ashley likes very full lips. So I'm doing a technique that's going to help round her lips out. And this is a new filler that I'm trialing. You can see how it's creating a nice show of her lips. Did you always feel that this left side was a little bit smaller than the right? Okay, yeah, I feel it too. I'm going to kind of round you out a little bit more. And then kind of mash it all and fix it. So this filler incorporates into the tissue very nicely. Ashley's got a little mole right here, which will be taken off one day. You might need a little bit more on this side to even you out.
I feel like I usually do.
Yeah?
Mm-hmm.
Open a little bit. Let me just kind of see. Yeah, you still look like you need a little bit.
Wow, I got two of the best docs right now. This is awesome.
You can see here. You can just inject a little bit right here. With a little more lift. It's coming together nicely.
Yay.
And then I'm going to give you some here to bring your lower lip down in the center. So Ashley doesn't feel anything because she has a dental block, which is numbing of the nerves of her lower face, really. It's a facial nerve block. And it allows for a very painless lip augmentation. She's not feeling any of this.
Nothing.
It's far superior than topical numbing cream. And it's super well tolerated among the patients. So you can see we're rounding her lower lip out a little bit and giving her that central pout and central fullness. So on her, I want to really stick to this portion right here and rotate her lip downward like that. So we're getting that. You are a little oozy, girl.
On what?
A little oozy.
Oh.
That's not bad, though.
Not that bad. A few glasses of wine.
I don't think I didn't drink. I'm trying to think the last time I drank.
Bianca saying, yay for dental blocks.
Yay!
I know you're going to want that top lip a little bit more than the bottom one. So we did the work not through her border, but injecting right around it. So it's a little puffy right now, but that will go down. And she's going to get a little bruise here. I can already see it forming. We are almost done.
I'm a bruiser.
Yeah. So we're almost done here. We're just injecting a little teeny bit more to give her a little height of the upper lip. And I'll do a little bit on this side. Ashley likes very centrally full and juicy lip.
Mm-hmm.
So we're just gonna kind of do that and smooth it all out. And I think we might be done.
Yay.
Let me just see if I can get any in here. Yeah, no. Yeah, you really have to pay attention to where you're at with this because of the syringe. The numbering was put on the syringe weird,
Yeah,
I think.
we got that feedback for sure.
Yeah.
You should be really numb now, huh?
Uh-huh.
So let me just get, actually Deb, could you hand me, or Justin, hand me that. And then hand me the big one so I can massage your lips.
What do you want? Oh, you want
one.
this?
Yeah.
Oh, okay.
And then one of those.
Can you just hold that and put it on us? Just keep it on us.
So one of those, and then this is the one for color.
That's it?
Yeah, just this, and then I like to put the one with color on, so then you can see. This is just to kind of incorporate a little bit more. What kind of feedback have you gotten as far as how quickly it incorporates in the tissue?
To be determined on that. We're told that it incorporates right away, like
Yeah,
it integrates nicely right away. But everybody says with the typical filler, it takes like 2 weeks to fully integrate.
Uh-huh.
So I'm waiting to get some feedback on that for if that's any different from us.
Okay. Okay, so I don't know if you want to look at it over time, Justin, and then let me see this. So we're all done with Ashley's lips.
Yay.
So I'm going to put a little bit of Vaseline on them to make them look good.
Nice and juicy.
Nice and juicy.
Juicy.
So let's see.
It's just so weird how your face feels.
So you're definitely blocked. So let me kind of get. So we really, even though her border is like puffy, right, that's where I injected. So it's really all in the pink of her lip, and she really wanted more show of her lips. She wants juicier lips. So
how
we use
pretty.
a juicier lip filler on her.
Beautiful. Really beautiful.
So let's see the big reveal here.
Oh my gosh.
Yeah.
Uh-huh.
Juicy, and I love the cheeks.
Yeah.
Love.
So you're like a new
I
woman.
feel like a new woman.
Beautiful.
I just can't talk.
Oh my god.
So you're gonna get a little bruise right there. You
That's
see
okay.
that, and then but I think in general,
All bruised.
evened out.
Maybe all night looking in the mirror.
I didn't even put it like here at all.
It looks
So
so
I'm
good.
trying to like get you a little more
Wow.
central. Like that.
Yeah, I like this filler.
You shouldn't
Yeah.
feel it. It should be pretty soft.
Yeah.
I can't feel anything right now, but
Yeah. Wow.
So can we say that you know you want to say anything?
I'll tell you guys why after the video.
Okay.
Okay.
So just look at my post and you'll see the name of the filler. But it is a new. It's been in the United States for
Since 2017.
since 2017.
It's been in Europe since 2015. It hasn't been launched in the United States. It's been approved in the United States since 2017.
So how long ago did you launch it?
3 weeks ago.
Okay, so this filler has only been launched in the United States 3 weeks ago. So it is extremely new, and it is going to be a game changer for the filler market. As you can see, it creates a very soft, I mean, you can't really tell because she has a little swollen from the procedure, but a very soft and natural looking lip. So, stay tuned.
Stunning.
I'm ready, Justin. I'm
Next.
I'm
She's next.
I'm next. Okay. Well, thank you guys for watching. So next week, what's going on next week?
We have, Allie Clifton. She is the host and reporter for the Western Conference LA Lakers champions.
Nice.
Yeah.
Yay!
Yeah.
That game starts tonight?
Yeah.
Yeah.
Final start tonight, game
Right.
1.
And then,
Party time. Right? Okay.
Yeah, we're it's like only 5:30, but we're good, right?
Yeah.
Do you want to say anything about? Oh, do we have special? We have a special.
Yeah, for October. We
Yeah, but
have.
do we have the what are we gonna do? Oh, I don't know. So that's it. If anybody
That's
has
a
any
wrap.
other questions, it's a wrap. We're gonna see you guys next week with the Lakers Lakers reporter. So stay tuned to that. We'll talk about all her beauty secrets and everything. Oh, this mess will kill me. And that's it. So thanks for watching. We'll see you guys.
Bye.
Bye.
Bye. we
Thank you.